Hello, my name is Jules Crawford and I am an employee here at Missouri Baptist Medical Center in the float pool. I also work at Goldfarb School of Nursing as an educator. Okay, the general role of the nurse. That's a little bit of a broad question, I feel like, a little on the vague side, because nurses have several roles in healthcare. You can have the role of an educator, which is part of what I do in my profession. You can have the role of a bedside nurse. You can have the role of a caregiver. You can have the role of the waitress. You can have several different roles within nursing. So the role of the nurse is all-encompassing. I feel like collaboration with other professionals is important for the nurse to think about at the bedside. We are the ones who are seeing the patient the most, and we know what to tell the physical therapist and the occupational therapist and the doctors and the case managers as far as information to get that patient home and on a safe road to recovery. Nurses work in several different practice settings. One can work at the bedside, one can work in a nursing home or a hospital. Nurses can work at camps as camp nurses. Nurses can be school nurses, you could be a community health nurse, you could be a jail nurse, so there's lots of different practice settings that nurses could be in. So my specialization is really not one particular field, because I am in the float pool. I am familiar with medical surgical nursing, I am familiar with intensive care nursing, telemetry nursing, so I have several different specialties that I am expert at. I would say my background is mostly ICU and acute care type settings, but I've worked in nursing homes, I've worked in the community setting. I have not worked with children, so that's not something that I'm familiar with. Day to day, my practice setting varies because I'm in the float pool, so never really sure where I'm going to be until about 1:30 in the afternoon when they decide what units need help, and then I go and help those units to finish the day from 3 to 7. So my week looks like 2 4-hour shifts at the hospital after I teach in the morning. So interacting with other healthcare professionals, I would say that I do that on a daily basis, whether or not I'm teaching or working at the bedside. Interprofessional healthcare is very important. We need to work as a team to get the patient to the best possible outcomes. I would say on a typical shift, I probably talk to at least 2 or 3 doctors, 1 or 2 physical therapists, possibly case management if I'm trying to discharge someone home. Pharmacy, I would say on a typical shift, I usually call the pharmacist at least 2 or 3 times to make sure something's correct in the computer. So we do work as a interprofessional team often, which is what we should be doing. And I think that that's the important part of CIPE that we're trying to get across to the young professionals going into these different fields.